Mobile County Health Officer Dr. Bernard Eichhold said the patient came to the health department about 2 o'clock yesterday afternoon with gastrointestinal symptoms.
There were some very vague symptoms. There was some communication issues from her native language, and then there was a history of some international exposure. She did not fit in the criteria of the 21 days of travel to an endemic area, but there were some questions in her story that kind of changed over time about family members in the Congo, which does have cases of Ebola.
Eichhold said after talking with colleagues, the decision was made for the patient to be evaluated at USA Medical Center. Why was she taken there by ambulance?
One was that was she going to be reliable in coming to get specialty evaluation. Two was that the concern was if we were going to err, we wanted to make sure we erred on the side of being correct clinically.
USA Medical Center Administrator Beth Anderson talks about how the patient was treated at the hospital.
We had a special room that we prepared in the emergency room. We took the precautions of moving all the patients out of the emergency room and going on diversion.
Hospital officials say the people who treated the patient had full protective outfits, wearing even more than what they demonstrated at a news conference earlier in the week. Infectious disease specialist Dr. Eduardo Calderon examined the patient and made these findings.
She hasn't been in a high-risk area recently in the last month or 21 days. She had lived in Mobile for 7 years, for one. Nobody had visited her from Africa or from high-risk areas. Clinically, she was stable, and her laboratories didn't show any evidence of infection.
As a result, the patient was released from the hospital. Reporting from USA Medical Center, Steve Alexander, Fox 10 News.